Hello, Loving Health community. Welcome back to the channel. My name is Kate. I'm the founder of Loving Health, where we provide you with evidence-based information for health and wellness. In this video, we're going to be discussing another general health information topic from our email newsletters. And if you would like the newsletters sent straight to you every 2 weeks, just send me an email at lovinghealthforme@outlook.com and I'll get you subscribed right away. Today's topic is cholesterol and cancer. The evidence has clearly demonstrated that what one eats affects their cancer risk. Many have become familiar with the saying, "sugar feeds cancer," and militantly avoid refined sugar at all costs. It's a bit more complicated than that. Cancer cells metabolize fuel abnormally and ferment glucose or simple sugars in the presence of oxygen, which is known as the Warburg effect. Because of the damaged mitochondria in these cancer cells, huge sums of glucose are allowed into the cell, which can be seen on a PET scan. This glucose is quickly metabolized, partly with an abnormally high fermentation rate, and is made into ATP, which the cells use for energy. To put it simply, cancer cells take up a lot of energy, and it's not just glucose they're after. For tumors to grow and cells to uncontrollably replicate, which is known as cancer, they need amino acids and fatty acids to build new tissues and blood vessels to feed that new tissue. In simpler terms, cancer cells require huge sums of energy in the forms of sugar, protein, and fat. In the 1970s, an association between abnormally low cholesterol levels and some types of cancer was discovered, which led to the belief that low cholesterol levels could be a causal factor for these cancers. It turns out that reverse causation is much more likely, or that cancer is what's causing the low cholesterol levels. A study looking at low cholesterol and mortality hypothesized that if reverse causation was indeed what was occurring, a declining total cholesterol level, not a consistently low cholesterol level over many years, would align with increased mortality. The researchers stated that a declining total cholesterol level would probably be caused by disease, whereas a low stable level would be due to a combination of dietary, lifestyle, and genetic factors. Of the 5,491 men in this study, examined over 6 years and followed for 16 years, 41% of the deaths were from cancer. The participants were divided into 3 groups of stable total cholesterol, low, middle, and high, and 3 groups of declining total cholesterol. So the groups that they divided them into looked at high to middle, high to low, and middle to low. Low was defined as total cholesterol under 180 milligrams per deciliter, and high as defined as over 240 milligrams per deciliter. The study results showed a significantly increased risk in cancer mortality in the group with declining total cholesterol from middle range at baseline to low, as well as an increased risk of all-cause mortality. Consistently low total cholesterol had no related risk with all-cause mortality, including cancer. These results are consistent with the multiple risk intervention trial and the 7 country studies, which demonstrated increased deaths from cancer with declining total serum cholesterol levels. The researchers stated, quote, "If only declining levels are associated with death by catabolic diseases such as cancer or liver disease, then the low total cholesterol mortality association may be explained by reverse causality, disease-lowering total cholesterol," unquote. And greater evidence of cancer-causing low cholesterol levels is demonstrated when a person's cholesterol returns to its usual range after successful treatment of the cancer and when it is in remission. A review of 52 population studies from various countries published between 1972 and 2009 demonstrated that the majority found an inverse association between cancer risk and cholesterol level. The researchers stated that an intriguing finding was that there was no set threshold for low cholesterol associated with cancer. What was considered low was not standardized across countries, and there was not a consistent number across the board where the cancer risk increased. Instead, a greater prevalence was found for 20% of the population with the lowest cholesterol in each cohort. The researchers stated, quote, If cancer reduces cholesterol level, we would expect the 20% of the population with the lowest cholesterol to have excess cancer regardless of the endemic cholesterol level of the population, a prediction that is not supported by the population studies when considered in aggregate, unquote. Data from the Framingham Heart Study showed that some participants had a drop in cholesterol up to 18 years before their cancer diagnosis, while others' levels declined near the time of diagnosis. The authors wrote that in some cases, the depressed cholesterol level was likely to be a precursor to tumor growth. If one's cholesterol level spontaneously fell without the use of medication, diet, or lifestyle changes, it could be a warning sign of preclinical cancer. How does cholesterol affect cancer's ability to flourish? Clinical and experimental studies have shown that high cholesterol levels and a high fat, high cholesterol diet affect cancer's ability to develop. And I'm going to go through some bullet points here of mechanisms that support this statement. Breast cancer models have shown a high cholesterol diet supports faster tumor formation as well as enhances their growth and spread. Dietary-induced cholesterol has shown to activate signaling pathways that increase metastasis of pancreatic cells. Cholesterol can directly activate oncogenic or stimulating tumor development, signaling through the hedgehog pathway. Tumor cells can reprogram their metabolism, increasing their uptake of cholesterol and decreasing their efflux compared to normal cells. So more cholesterol is going into the cell and less cholesterol is coming out. What is happening to all of that cholesterol in the cell? These cells also synthesize more cholesterol, so they can make more. Cholesterol within cells can activate signaling pathways that increase cell proliferation, invasion, and metastases. Low cholesterol in cancer patients returns to normal after tumor remission, demonstrating the role of LDL, low-density lipoprotein, which shuttles the cholesterol to different tissues in the body, in tumor growth and development. High cholesterol has shown to cause increased tumor angiogenesis, proliferation, and reduced apoptosis, programmed cell death. So all cells have an apoptosis mechanism where they can kill themselves off if something goes wrong, they're malfunctioning, but cancer cells are immortal. So somehow they evade this apoptosis mechanism and won't let the cell kill itself off when it is malfunctioning. Cholesterol is the precursor for the synthesis of steroid hormones, which in excess can increase cancer risk. And you can view Loving Health's video or article on hormone replacement therapy and breast cancer if you would like to learn more about that topic. Cancer cells can use cholesterol to develop a tolerance for stress, evading ferroptosis. So similar to apoptosis, but ferroptosis is cell death from stress. So when a cancer cell tries to break off from the original tumor site and metastasize or spread throughout the body, it's a very stressful process, and most of them die. But those that survive end up breaking off and spreading throughout the body. And cholesterol seems to raise the cell's tolerance for stress, so it is easier for them not to be killed when they try to break off and evade the rest of the body's tissues. Cholesterol consumption is associated with increased risk of gastrointestinal cancer in epidemiological studies, specifically when consumption of plant foods is low. Excess dietary cholesterol is a stimulus for tumor growth in mice with intestinal cancers. So, how can one effectively manage their cholesterol levels in terms of cancer outcomes? Epidemiological evidence showing that statins decrease the risk of cancer is mixed, and evidence for decreasing cancer mortality and improving survival, which is what we want, is scarce. A meta-analysis from 2020 demonstrated potential survival benefit for statins. However, results were limited for improved recurrence-free survival and showed no benefit for progression-free survival. The body makes all of the cholesterol it needs, and only a small percentage of the population has a genetically high cholesterol level that cannot be drastically lowered with diet. If cholesterol-containing food choices remain consistent, lowering markers pharmacologically with statins guarantees the same amount of cholesterol to be entering the body, still providing an excess to influence cancer growth and metabolism. So a more significant question may be, is consuming unnecessary dietary cholesterol worth the risk? And that's all for today's topic. I hope you enjoyed learning about how cholesterol can influence cancer in today's video, and if you found this information useful, please like and share the video. I'll be back next time with more evidence-based general health information. Bye guys, have a great day.